Why do some generic drugs fail? In one of the videos in this channel, we uncovered the surprising truth about generic drugs, how they offer the same benefits as brand name medications but at a fraction of the cost. But here is where things even get more interesting. Are all generics truly equal? Some studies suggest that certain generic drugs can be up to 45% less effective than their brand name counterparts. If they are FDA approved, how is this even possible? Could the pills you are taking right now be failing you? Welcome to Med the Pharmacy in Focus. I am your host, Nicholas, the pharmacy practitioner. Let's delve deeper into the shocking reality behind this fascinating discussion. Generic drugs are supposed to be the affordable and equally effective alternatives to the brand name medications, okay? There are nearly in 95% of prescription filed today. But here's the problem. Some people experience unexpected side effects, reduced potency, or even complete treatment failure. Why is this happening? Today, we are exposing the hidden flaws in the generic drugs that could impact your health. Here is what many people don't realize about generic drugs. Number one is that generic drugs differ in fillers and binders from the brand name medications. While the active ingredient is the same, the inactive ingredients like fillers, dyes, and coatings can alter how the drug is absorbed in the body. Number two, variation in potency from the brand names. Generics are allowed at 20% variance in drug absorption compared to brand name versions. That means a heart medication or antidepressant could be significantly weaker or stronger than expected. Okay. Number three, manufacturing differences. Not all generics come from the same facilities as brand name drugs. Some are produced overseas with less oversight, raising questions about quality control. You might be thinking, but generics go through strict testing, right? Well, yes and no. Here is how it actually works. We begin by equivalent studies. Instead of full clinical trials, generics only need to prove that they reach the bloodstream within 80 to 125% of the brand name drug. That's a huge range, especially for medications with a narrow therapeutic index like thyroid hormones or blood thinners. In the real life failures, in 2012, a generic bupropion was pulled off the market because patients reported severe withdrawal symptoms and worsening depressions. Why? It was not being absorbed at the right rate. The overseas factor. Some generics are produced in facilities with the lax quality. This leads to cases where patients got drugs with the contaminants or incorrect dosages. This is shocking, right? Here is the part they don't want you to know. Not all generics are created equal. Some brand name manufacturers secretly make authorized generics identical to the original drug just without the branding. But many generics, they come from completely different sources. Here's a tip. Next time you get a prescription, ask your pharmacist which company makes your generic, okay? And whether there is an authorized generic available. It could make a huge difference in effectiveness. So, to recap on what we have learned, number one, generic drugs are not always identical to brand name versions. Number two, some generics can have differences in absorption, potency, and side effects. Number three, not all generics come from the same trusted manufacturers. The next time you switch to a generic, Pay attention to how you feel and don't hesitate to talk to your pharmacist if something seems off. Have you ever had a bad experience with a generic drug? Comment below. Thank you and see you in the next video. Bye bye.